Burns have the potential to affect the skin, muscles, nerves, bones, and blood vessels. They can also injure organs, such as the eyes and respiratory system, beyond repair. Burns vary from minor to extensive and can be physically and emotionally damaging. Patient assessment that evaluates the source, location, depth, and severity of the burn is vital in determining the course of treatment. Classification of burns. Superficial burns involve the top layer of skin, the epidermis. These injuries are minor, causing mild to moderate pain, and generally heal quickly without medical intervention or scarring. Superficial burns are referred to as first-degree burns. Partial thickness burns damage the epidermis and the dermis. These burns are painful and cause blisters that often persist for up to 48 hours. With care, these burns will also heal with little or no scarring. Partial thickness burns are also known as second-degree burns. Full thickness burns are the most severe type of burn. In these type of burns, all layers of the skin are involved and are often black and charred. There may be damage to the subcutaneous tissue, muscles, bones, and underlying organs. If there is extreme nerve damage, the patient may not feel pain on a portion of the burn, but the surrounding partially burned tissue may cause pain. With full thickness burns, extensive scarring and infections commonly occur. Severity of the burn. When determining the severity of the burn, consider the source of the burn, the area burnt, the depth, extent, age of the patient, and any other injuries. Different sources of burns affect the body differently. With electrical burns, look for where the electrical current entered the body as well as where it exited. As the current travels through the body, internal damage may have occurred. With chemical burns, if the chemical has not been removed, it will continue to burn the skin further. Pay special attention to the area of the burn. Burns to the face and neck are of great concern as they may compromise the airway. Burns may constrict tissue and cause surrounding tissue to release fluids that lead to swelling. This can lead to blood flow restriction and complications such as upper airway obstruction and other complications. Also, be aware that elderly and young patients are at a greater risk for infections and death from burn injuries. Estimating the extent of the burn area. There are two methods to estimate the extent of tissue burned. The first method is the rule of nines. Each part of the adult body is considered 9%, the head and neck, each upper extremity, the chest, abdomen, upper back, lower back, and buttocks, the front of each lower extremity, and the back of each lower extremity. All of these sections account for 99%, and the genitalia make up the remainder 1%. Pediatric calculations differ based on relative body proportions. The head and neck account for 18%. Each upper extremity is 9%. The chest and abdomen is 18%. The entire back is 18%. Each lower extremity is 14%, and the genitalia is 1%. The second method to calculate the area burnt is the palm method. Measure the extent of burn using the patient's own palm as a guide. The palm equates to 1% of body area. This method works on adults, children, and infants. Classification of burns by severity. Burns should be classified by their severity in order to provide appropriate treatment. Minor burns include superficial burns of 50% of the body surface area or less, partial thickness burns of less than 15% of the body, full thickness burns less than 2% of the body, excluding the face, hands, feet, genitalia, and respiratory tract. Moderate burns. Superficial burns of 50% of the body's surface area or more. Partial thickness burns of 15 to 30% of the body. Full thickness burns of 2 to 10% of the body's surface area, excluding the face, hands, feet, genitalia, and respiratory tract. Critical burns. Partial thickness burns of more than 30%, partial thickness or full thickness burns involving the face, hands, feet, genitalia, or respiratory tract, full thickness burns of more than 10%, all burns complicated by injuries of the respiratory tract, other soft tissue injuries, and injuries of the bones, burns complicated by musculoskeletal injuries, and circumferential burns. Burns in infants and children under 5 are classified differently due to the increased body surface area in relation to the total body size. Partial thickness burns of less than 10% of the body surface area are classified as minor burns. Moderate burns are partial thickness burns of 10 to 20% of the body surface. Critical burns are full thickness burns or partial thickness burns encompassing more than 20% of the body surface. For geriatric patients older than 55, burns classified as moderate should be considered critical. Note, the burn classification is according to the Brady Emergency Care 12th edition. Treatment and patient care. Thermal burns are one of the more frequent types of burns EMS workers respond to. Begin by stopping the burning process by wetting the area with cool water. Do not remove any grease or tar if it is stuck to the patient. Ensure the airway has not been compromised by looking for soot, singed facial hair, or burns to the face. Complete a primary assessment and apply high concentration oxygen. Evaluate the amount of area burned. Remove any jewelry and clothing if it is not adhering to the patient. Finally, wrap the burned tissue with dry sterile dressings and transport. Chemical burns must be treated immediately to reduce the amount of injury. If the chemical is a dry powder, first dust off as much of the powder as possible. Next, for both liquid and dry chemical burns, flush the burn with copious amounts of water for at least 20 minutes. Cover with a dry sterile dressing and transport immediately. Refer to the Materials Safety Data Sheet (MSDS) when applicable to provide appropriate treatment. For eye burns, carefully flush with water for at least 20 minutes, making sure not to get any of the solution into the unaffected eye. Next, cover each eye with a moistened pad. Electrical burns can be very severe. The injury includes the area between the entrance and exit points, and may include deep structures as well as internal organs. Electrical burns can cause paralysis, muscle tenderness, respiratory difficulties, irregular heartbeat, and cardiac arrest, as well as seizures and broken bones from extreme muscle contractions. Before treating these patients, be sure that the area is safe and there is no potential danger. Begin treatment by assessing the patient's airway, breathing, and circulation. Often patients with severe electrocutions will have abnormal heart rhythms and defibrillation may be necessary. Administer high-flow oxygen and apply spinal immobilization. Check for both entrance and exit wounds and dress with a sterile dressing. Transport immediately.